Thank you very much, Mr Speaker, and I want to thank the member for Indi as well as the member for Farrer, who has been making repeated steps forward and working with the government to support the border regions on both sides. And so to acknowledge both members for their work. We are very aware of a significant outbreak which has now seen over 450 cases across the border regions on the Albury and the Wodonga side. In particular, we are working with both state governments as well as both communities to address this challenge. Firstly, in relation to vaccination, I'm pleased to be able to report that in the Albury LGA they have reached 98% vaccination coverage, and in the Wodonga LGA 97.7%. So two of Australia's most vaccinated local government areas, and to see that in a regional area I think is very heartening. It provides important protection for both of those communities. There are over 30 vaccination sites, Commonwealth vaccination sites, across the two communities. I think 18 general practices, 11 pharmacies, 1 Indigenous medical service, and in addition to that we have 1 Commonwealth vaccination clinic, so 31 Commonwealth sites which have been providing vaccinations. A further thing which is extremely important is, of course, the testing, and this has been raised by both members, the member for Farrer and the member for Indi, with me. And at this stage we have a pop-up clinic at Lavington Sports Ground, a drive-through clinic at Albury Showground, a pathology clinic in Lavington, walk-in testing at Wodonga Respiratory Clinic, drive-through testing at the Wodonga campus of Albury Wodonga Health. Importantly, we've been working with the Victorian Government, and the Victorian Deputy Chief Health Officer Ben Cowie has stated publicly that they have responded and will be providing additional testing resources this weekend. And I think that that's a very important message to the people on both sides of the border, that those representations have resulted in increased testing activity. My office has also been working with private rapid antigen test providers. Rapid antigen tests will be available from the 1st of November, and they have confirmed that there will be strong and significant supply within the border regions. That will grow through pharmacies and convenience providers over the course of the first 2 weeks, but will be available from the start of November. Finally, in terms of PPE, we've now made 3 deliveries in recent weeks to support the health services. So Commonwealth National Medical Stockpile deliveries on the 14th, 18th and 26th of October of P2 masks, surgical masks, gloves, gowns, goggles, shields and sanitisers. So all of these things are coming together as part of the Commonwealth's response, and I thank both the member for Farrer and the member for Indi for their representation.